channel. Hey, and welcome to today's video. Today we're going to talk about degenerative joint disease. And this can go by many names. It can go by what's called DJD, it can go by spinal arthritis, degenerated spine, all kinds of different terms that are used. And this is one of the most commonly discussed subjects in my practice. A lot of patients ask me questions about this, and they're told generally that this is a normal condition, that as we age, our spine is going to degenerate. And while this is true to an extent, of course, as something ages, there is going to be some wear and tear on the joint. It is not necessarily a normal finding for you to experience degeneration to the point of arthritis. And I'm going to show you how I can say that and explain why that happens here in just a minute. But let's go ahead and establish the fact that even though this is common and happens a lot, that it's not necessarily a normal situation. So what happens and what causes degeneration in the spine? Well, a normal spinal segment, okay, is a bone with a disc and then a bone. And in between the bones you have a hole that the nerve comes out of. Now, this disc, the way that it gets its nutrition is through the motion of the joint, through the bending and the twisting that goes on in your spine as you go through your everyday life. And what happens is through a process called imbibition, the disc actually sucks nutrients out of the bone, and that's how the disc gets fed. The disc does not have a blood supply of its own. If you get a vertebral subluxation, which if you don't understand what that term means, go back, I think it's about 2 weeks through this blog, and you'll see a 4-part series that talks about how chiropractic works, and that'll explain completely what a vertebral subluxation is. But if you get one of those in your spine, what happens is this joint will lose its normal range of motion. And when it loses that normal range of motion, then of course the disc is not getting fed the nutrients. So this begins a process of degeneration. And what will happen is this disc will start to starve. And in phase 1 of the degeneration, the disc will actually start to thin out, okay, and it gets what's called a circumferential bulge. If you look at it from the top up here, you'll see how it kind of bulges a little bit out here. That's because the fibers are starting to get weak. Now, this is the beginning of that joint disease, degenerative joint, decaying spine, different things like that. This is the beginning of that. It's phase 1. If it's allowed to continue, you get into phase 2. And what happens in phase 2 and phase 3 is as that disc thins, the body starts, the bones of the spine actually start experiencing abnormal stresses. And there's a law called Wolff's Law, and that says that when there's an abnormal stress put on a bone, the body will lay down more calcium to protect that bone. So this is what happens. The joint goes from nice, smooth edges to start laying down calcium deposits. These calcium deposits are called osteophytes, and what those are is the body's attempt to protect itself. So you'll notice these bone spurs starting to happen. You'll also notice that that disc is continuing to get thinner and thinner because it's still starving. And as it gets thinner and thinner, it gets weaker and weaker, which will predispose it to a disc herniation or bulge, which you all have probably heard about. If this continues even further, then you get into what we call phase 4 spinal degeneration, where there's almost no disc left and you have bone on bone, which is not a good situation. So this is what spinal degeneration actually is. Now here's a question for you. If spinal degeneration was a factor of age and age only, then why is it that in most spines, and this is true in most cases, most spines you will find, 1 or 2 or 3 levels that have this degeneration, but then the levels above and below it are normal. And the reason for that, or the importance of this question is that if age is a factor and if age is the reason that this happens, then why would one segment have it happen but the other ones wouldn't? Well, the reason behind that is because if you have that subluxation in your spine and that subluxation sits there for too long, that's how that disc deteriorates. And subluxations don't happen in every joint of the spine. They only happen in the ones that are injured or have abnormal forces put into them. So what can we do about this? Well, we're not going to reverse what has happened. We're not going to get rid of the bone spurs, and we're not going to take these discs and plump them back up to normal. There may be some improvement in the disc height, but it's not going to plump back up to normal. But what you can do is through maintaining regular adjustments, we can actually put the joint motion back in to keep this from getting any worse, to keep that disc from starving any further. So obviously, the younger that you catch this and the younger that you get in there and start maintaining that joint function, the better off you're going to be. So, if you're 80 years old and you're just getting your first adjustment, you're going to have less of a chance of recovery versus somebody who's in their 20s or 30s that we can get before the degeneration has gotten too far. So that's definitely a factor to keep into consideration, and we do have the technology to measure that function to make sure that your range of motion is normal, that there's no pressure on the nerves, and we can always check that out for you. So that is the story of spinal degeneration. Again, it is common, but it's not necessarily normal, and it's not necessarily something that you're destined to experience. And that's the kiss from Kelly. Anyway, have a great day, and we'll see you tomorrow. Thanks.